Hello, everyone, and welcome to another episode of All Politics Are Local. I'm WSAV Now reporter John Dowding. Every week, we take the time to break down some of those big headlines coming from Washington and Atlanta and see how it impacts us right here in the Coastal Empire and Low Country. As always, we're being joined by WSAV Washington correspondent Kelly Meyer, who's back in the newsroom today. Hey, Kelly, how are you doing?
I'm doing great, John. Thank you for having me. Yeah, we're back in the newsroom here in our DC bureau. We're still wearing our masks, still maintaining social distancing, doing this in different teams to kind of keep bringing you the news, but doing it safely.
Yeah, I mean, hey, at least it's a sign of things going back to a new normal, so to speak. Kelly, you had a busy weekend again, and there's been a lot going on in Washington. I mean, in general, here locally, we're seeing everything going on with all the local election stuff. We're getting closer and closer to election day, seeing all those nonstop political ads, and definitely something that's going to be incorporated in all of those, at least from a Democratic standpoint, is this New York Times report from over the weekend on the President Trump's tax returns, which Democrats have been trying to get their hands on since he came into office, and it looks like the New York Times was able to get a copy of them and revealed some really crazy, honestly, information about the president's tax returns. They said that in 2016, 2017, he paid $750 in federal income tax. And then in the past 15 years before that, in 10 of those 15 years, he didn't pay any federal income taxes. So, Kelly, what are you hearing from local lawmakers about their in Washington? What are you hearing from Washington? What are people saying about this latest revelation?
Yeah, I mean, like you said, this is a huge thing to drop on a Sunday night. A Sunday night that's just 2 nights before the first debate. The first presidential debate is happening Tuesday night. And then just with weeks to go into the election. And like you said, this is something that they have been looking to unveil or reveal with for the past, since the past election as well. So when this news dropped, President Trump was actually having a press briefing at the White House, and what he said when he was asked about it, or brought it up, called it fake news, and that this was not true. But of course, the New York Times is reporting this. I know other sources and outlets are working to confirm it on their own, as we are. But I know right now we're crediting the New York Times for that reporting. Looking into reaction from Capitol Hill, I'm sure you can expect that that's going to be the question lawmakers are asked here. It is a holiday, a Jewish holiday, so I'm not sure if you'll see the senators filtering through the halls today, but as soon as they're back, I'm sure that will be the first question reporters up on Capitol Hill and myself will be asking.
Yeah, and I mean, you bring up a great point too about there being the first presidential debate tomorrow night. This is definitely probably going to be either one of the main points that we're waiting for during the debate, or honestly, just the first question that moderators ask outright. So, definitely we'll be keeping you guys updated, those watching, as we learn more here in our newsroom here in Savannah, as well as Kelly learns in Washington. So, as always, we'll bring the latest updates with that. Kind of talking again about latest actions going on in the Trump administration, was on over the weekend, the president announced his nominee to fill the late Justice Ruth Bader Ginsburg's seat on the Supreme Court. He announced he's nominating Judge Amy Coney Barrett to replace her. She is a more conservative judge. She is, I think they said she's a mother of 7. She was a law clerk for the former Justice Antonin Scalia as well. So, Kelly, you were there in the Rose Garden when this announcement was made. Tell us, what did you hear from the event? Tell us what the president said, why he wanted to, he vowed that he was going to replace Justice Ginsburg, her position on the court, with another woman. But it's not exactly the same sort of ideology that the two of them share. So Kelly, tell us a little bit more about what you've heard and what lawmakers are saying about this pick.
Yeah, I mean, like you said, she did reference her mentor and someone she learned from, Antonin Scalia. Said she's going to follow the law as she, hopefully, as she says, gets confirmed in this role. And President Trump said this was one of his quote highest and most important duties that he was set there to fulfill. For him, he is saying that this is his third nominee, and as he's hoping his third justice to put onto the Supreme Court. And he hopes to have a swift confirmation process, which is why he did this within just a week after Justice Ginsburg's passing. So now it turns into the whole battle on Capitol Hill of how quickly this process is going to go through. We're looking out for Judiciary Committee chaired by South Carolina Senator Lindsey Graham. Probably within an hour after the announcement, already put out his schedule, laid out the hearing schedule when they're going to pick up with this, October 12th. So they will be working on that and on track, it looks like, to maybe have this vote before Election Day, which is what Republicans are pushing for and the president is pushing for, to have her secured before the November 3rd election.
Yeah, and I mean, that's what, like you said, that's been the number one thing on the Republicans' mind going into this, was trying to get her in the court, on the court before the election, in an election where we're already anticipating it to not be traditional. You have a lot of people filling out absentee mail-in ballots, doing early voting, which are, practices that have always been around, but people are taking advantage of more because of the pandemic and the current situation, the circumstances we're all experiencing right now. And it definitely does look like Republicans, as of right now, they have the votes in the Senate to be able to possibly confirm this nominee to the court. And something else you brought up, Kelly, was obviously the next step of the process. It's the president nominates his nominee for the seat, and then it moves to the Senate Judiciary Committee, where they, as we've seen in the past with Justice Kavanaugh, when during his confirmation hearing, they kind of grilled these people over their legislative legal history, about what values and ideals they want to uphold, about their past, different things like that. And the South Carolina Senator Lindsey Graham is the head of that committee. He is facing probably the toughest, closest race in his political career in the Senate in South Carolina. Right now, polls are tied in a dead heat in South Carolina. Honestly, I never thought we'd be saying that, with his Democratic challenger, Jamie Harrison, who works with Representative Clyburn of South Carolina, been endorsed by a number of high-ranking Democratic officials. So, and in 2016, Lindsey Graham is on the record of saying, if this happened, in referencing the Merrick Garland situation with President Obama, he said, whether the president was Democratic or Republican, hold me to my words when I say that, I'm paraphrasing, mind you, that, if this were to happen again, we would wait for the next president to nominate someone to the court. Well, it doesn't look like that's what a lot of Republicans are doing, and he's not really doing that himself. I kind of want to talk with you, Kelly, about, what sort of impact this may have with his with his chances of winning re-election. We know a lot of Americans are supporting that wait sort of mentality. Saw some polling over the weekend, I believe, from the Washington Post, saying that a majority of Americans still support that idea of waiting for the next president to fill the seat. Kelly, what impact may Lindsey Graham's actions have on his re-election bid?
I think he wants to use this as a way to say he's getting this done. To show his power as the chairman of the Senate Judiciary Committee, to say he can move this through, to do Trump's bidding, to win over that support and those voters in the state. He's been going on Fox News within the past week, as they've been asking him about this nominee and asking him about this process going forward, openly asking people to donate to his campaign, to pitch in. He's stated that he knows he's behind and needs help. He's asking people to help him, to pray for him. So he knows he's in a vulnerable position, and I believe he's trying to do whatever he can and hope that pushing this through and doing that work may give him some leverage or may win over some support for him in the state. So he's going to do whatever he can to deliver on this promise, to show voters what he can do up here on Capitol Hill.
His judicial philosophy is mine too. A judge must apply the law as written.
And shifting gears here now, talking about something else that was revealed from the administration last week. I believe we saw Joe Biden, there's so many titles with these people. Former vice president and now Democratic nominee for president, Joe Biden, releasing his healthcare plan about a week or two ago. And now we're seeing the president releasing his plans in the form of kind of an executive order, sort of a statement. We're kind of unsure of the political power, the actual legitimacy of whether this can be something that is ruled on and something that is enforced. But regardless, he's releasing some sort of plan about what he would like to do in his second term if he's reelected with regards to healthcare. So Kelly, tell us more about how this plan that he's releasing, tell us how it's going to impact us, here at home. What might that look like for us?
Yeah, well, I was covering this at the end of last week, kind of as obviously we were looking at the services here on Capitol Hill for Justice Ginsburg, and then also moving into the SCOTUS debate. But within that, President Trump unveiled this healthcare plan. He calls it his America First healthcare plan. He's saying that it would end surprise billing, lower premiums, send seniors $200 for prescriptions. We caught up with Health and Human Services Secretary Alex Azar on Friday to kind of dig into what this is, what exactly is in this policy. And what's interesting about it is it still includes a major part of the ACA, the Affordable Care Act, Obamacare, that's protecting those with pre-existing conditions. That's something that the administration is saying now that they aren't going to get rid of. That is going to be a sure thing. Take a listen to what Azar had to say when I asked him why they're keeping this part and how they're going to keep that without the framework of the ACA.
He will ensure actual protection of people with pre-existing conditions. There are many ways that you can ensure that people have access to affordable health care who have pre-existing conditions. The Affordable Care Act has one approach because of the infirmities in the individual insurance market that are inherent in how Obamacare was poorly designed. As I mentioned, it doesn't actually provide access to affordable insurance for so many Americans.
And then just following up on that with some reaction as the plan was unveiled from both professors and Democratic lawmakers. They say they wouldn't even call it a plan. They say it's empty, there's nothing in it. They're also saying that even one professor I talked to at GW was saying that it could be considered propaganda, government propaganda, and that she was really warning voters to be wary of what politicians tell you, especially in these weeks leading up to the election, to question what you're being said basically from politicians and look at this policy and see what's inside of it and try to see through some of the wording is what she warned me. And we could take a listen to her here as well.
They just, the sort of general aspirational statements are not specific enough to understand that. And healthcare is incredibly complicated. Everybody agrees with those central goals. We'd all like better healthcare. We'd all like choice. We'd all like it to be affordable. And I think most of us would like not to exclude people with pre-existing conditions. But how do you do that? It is a complicated process.
I mean, something that really stuck out for me was, in what you were explaining, was the desire to keep pre-existing conditions. That was something that was fought back on in a lot of in that initial effort to try to repeal and replace Obamacare back in, God, my sense of time has just evaporated with the pandemic, but I want to say it was back in 2018, maybe, Kelly, 2018-ish.
Yeah, I mean, that's what Democrats are saying, that it's just been, he spent the majority of his presidency pushing back on Obamacare, saying in his campaign promises he was going to repeal and replace. They still are. The Obamacare, the ACA is one of the first cases that the Supreme Court is scheduled to hear just a week after the election. He's still trying to dismantle it, but yet keeping parts of it into his own plan without explaining. And I spent probably about 10 to 15 minutes talking with Azar exactly how they're going to do this. It's a complex issue. The entire medical bill here to talk about how this is all going to work. A healthcare plan is completely and entirely complex. So for them to not be able to explain exactly how it's going to work was interesting.
Really random question for you, just popped in my brain. I'm surprised it did it on a Monday morning. When you were speaking with Secretary Azar, did he say if COVID-19 would be considered a pre-existing condition? Because we're seeing
I think it is. Yeah, I think it is being considered that now. We didn't talk just about that. Actually, ironically, I had asked him, one of his security details, it was being reported that they had tested positive. So we had quickly moved to a Zoom call rather than an in-person interview for Friday. And I'd asked him if he had contracted it, if he had been tested. And He said not to believe all the stories you hear in a Capitol Hill Politico outlet here. So he didn't quite answer that question. We did talk a bit about vaccines, but I think that's a really interesting point and something to recognize as we go forward. Obviously, this is an entirely new threat we're facing, and if that will be considered a pre-existing condition as well. So it's a fascinating conversation. It's like we said, very complex. There's a lot to it, and it's something that was kind of just pushed in there along in this whole everything else that was happening last week.
Of course, I mean, I hate to say it, but it's unprecedented times here where we're all trying to figure out the unpredictable and trying to predict the unpredictable, I should say. Thank you so much, Kelly, for joining us and helping us try to understand and predict some of the craziness that's going to be going on. And definitely everybody wants to stick with us in the next couple of weeks as we get closer and closer to the election. We'll be providing all the information you guys need to know from here and on Capitol Hill. Thank you so much, Kelly, for joining us today.
Thank you so much for taking the time. It's great to chat with you as always.
Of course. You can see more of Kelly's stories on our website. Just go to wsav.com/Washington. You can catch up on previous episodes of All Politics Are Local as well on our website. Just go to wsav.com/allpoliticsarelocal. Thank you so much again for watching. I'm John Dowding. We'll see you again next week on All Politics Are Local.